Aged care is one of those unglamorous but important areas of policy. Done well, it has the potential to drastically improve the quality of life experienced by people at a time of life where they really need assistance and can be vulnerable. But done poorly, it's a money pit that will continue to deliver subpar outcomes. And that impact is only going to grow in the years to come. The Royal Commission into Aged Care Quality and Safety said it's projected that the number of Australians aged 85 and over will increase from around 500,000 in 2018 to 19 to more than 1.5 million by 2058. That's a tripling of the number of people in the age bracket most likely to need help. Now, the Royal Commission heard some shocking stories of abuse, neglect and exploitation. But there are wonderful examples too, from Pinaroo in Roma, run by the local Rotary Club, through Bowen and Villa Maria on the Gold Coast, and a whole lot of others that do great work. Many really do their best to provide support and genuine warmth to those who reside there. But a concern I have is that whenever a Royal Commission does its thing, the answer is always to offer more regulation. More regulation means more administration, more people doing that administration, higher costs associated with making sure it all gets done. And that either means less money being available for caring for the people who are residing there, or higher prices for the people who need to pay the bills. And all of that leads in the long term to lower standards or care costs that are out of reach of the ordinary person. There's a tension here between having enough clarity on expectations and consequences for those who do the wrong thing, and on the other hand, freedom and flexibility to use resources in the way that best suits the particular residents and their needs, the geographical quirks of that location and the unique offering in the market by that service. Member for Warrego, Anne Lay, and I have spent some time on the road in her electorate dealing with this issue. There's a problem with the formula that's used for funding aged care, assuming a fairly high critical mass, that is, a fairly large number of people in that service. And that's not always an assumption that's borne out in rural areas. And yet, people need to be cared for in the communities where they've lived their lives, because that's where their networks are. It's where their family support and supervision lies, and with it, those eyeballs on them in care that are needed to make for accountability and quality. The worst thing to do for care quality is to uproot a person and place them where they won't get the visits that are needed to keep their provider accountable and on their toes. There are industrial relations concerns too. In Dalby, the local council recounted to me that the one local aged care facility they had been run by a not-for-profit, but they packed up and left when they realised it wasn't viable for them. But as soon as the council stepped in to ensure the service was still being offered, the local government award kicked in, massively spiking the amounts they were required to pay staff, and with it jeopardising the affordability and viability of the service for residents.